Welcome everyone to week number 5 in Science 200. We have met our halfway point in the course. We only have 4 weeks left to go. You're still working on your projects, so we will get into that in just a minute. And you will continue to work in your Sumo web text. So let's see what we've got going on. All right, last week, week 4, you learned about scientific communication and you determined who your audience will be for your presentation of your topic. And why is this important? Because you have to decide how you are going to reach your audience. How are you going to express yourself to the point where you are understood to whoever your audience is. So that is terribly important for any presentation. No matter what you're doing, you have to figure out who your audience is, what they already know, what they want to know. Plus, you have to convince them that they want to know this, and then communicate your information to them. So scientific communication is very important. It is very important for any type of presentation to an audience. So this week we've got chapter 5, which is in your Sumo web text. And you're going to read a lot about biases in science. So what is a bias? A bias is a preconceived notion, a way of thinking about a topic that's usually based on your prior experiences. Sometimes it's not, but usually it is. And is a way of looking at something, looking at a problem that you have, that you see, that clouds your objectivity. So objectivity is taking away a bias or any type of bias and having you just look at the facts. What is the information that is in front of you? There's all types of biases out there. There's researcher bias. So you go in, if you've done enough background research, you go in with a preconceived notion about what you think is going to happen. And you even design your experiments using this because you are already thinking in a particular way. Sometimes that's not good. You have confirmation bias where you expect something to happen, right? If you're working with clients, patients, subjects, they can introduce bias into your study, especially if they know what's going on, especially if they know what you expect the result to be. They can give you an answer that they hope will help you. You know, a bias isn't something terrible or bad. It's just something that happens that you really don't want to happen. And so one way to take out bias out of a study is to do double-blind studies. And this is important because the researcher, as well as the subject, patient, client, whatever you want to call them, has no idea what the particular treatment is. Now, when COVID first hit the scene in 2020 and we started developing vaccines, I volunteered for the Pfizer vaccine trials at the very, very beginning. I looked for a vaccine trial near me. One was near me in Charlotte, North Carolina, and I signed up for it. It was a double-blind study, so neither the researcher nor I knew what I was getting. Was I getting a placebo? So a placebo is no treatment whatsoever, but with a vaccine, they still have to poke you, you know, and put something into your body. So it was basically salt water that they put into me because, of course, you have no idea what my luck is like. But, yeah, I have terrible luck. So I got the placebo for the first 6 months, I think it was. So this study was supposed to go on and on and on, but what was determined was that the vaccine was actually very effective in preventing COVID. And so they stopped the study early and they gave participants like me the real vaccine. I had already had 2 placebos. So I had the original vaccine and then I had a booster, but they were both basically salt water. So that's a double-blind study. So you take out bias. You take out bias from your subject, client, patient, whoever it is, and the researcher. That's a double-blind study. You see this all the time in clinical trials. So say someone in your family has a very rare type of cancer. You can look up clinicaltrials.gov and see if there are any clinical trials around the country where experimental drugs are being used to treat this rare type of cancer, and sometimes you will find that. Well, going into a study like this, you're going to have some kind of experimental treatment, but you won't know whether you're getting the placebo or the experimental drug. That's a double-blind study. Almost all the clinical trials are like that. Okay, in Chapter 5, it also talks about p-values and confidence levels. So a p-value, little p stands for probability. P-values tell you after they have been calculated. So this is statistics. After they have been calculated, this tells you the probability that this event happened by chance. Okay? So if you want to show a cause and effect, then you want the p-value to be extremely low, because you don't want this effect just to happen by chance. You want it to be caused by the thing that you're testing, right? So p-values need to be extremely low if you want to make connections between cause and effect. P-values of 0.05 to 0.01 are what you are looking for. So you're saying that only 1 to 5% of the time you would expect this particular effect to happen just by chance. So you want p-values to be low. Confidence levels are different. Confidence levels tell you how confident you are that this particular thing is happening. So you want them to be higher, and they fall within a range, whatever the results are. That's confidence levels. You also get a taste of a scientist's work. Gregor Mendel was an Austrian geneticist. Of course, he didn't know he was a geneticist. He was just studying some English peas in his monastery, and he did experiments to determine how traits are inherited. Now, the most important thing about his work was that he did this experiment over and over and over. He counted tens of thousands of pea plant progeny through his experiments, and he determined recessive and dominant traits and the fact that each individual has 2 copies of each trait. Now, don't we understand that now? Yes, because we get half of our chromosomes from our mother, half of our chromosomes from our father. That's 2 different copies of a trait. And we also understand recessive and dominant traits, don't we? There are other types of inheritance, and fortunately, he didn't run into that with his English pea plants, because if he had of, that would have changed his results tremendously. But he collected a tremendous amount of data and analyzed those data and figured out that each individual contains 2 copies of a trait. And there were recessive and dominant traits. Recessive traits can be hidden. Dominant traits are always exhibited. So he developed the first really important work in genetics, even though no one understood what DNA was. No one understood what a gene was. No one knew what was being transmitted between parents and offspring. But he started this very important work, and it all came about because he was so diligent in counting his pea plants and looking at the traits of those peas. You'll also delve back into the Deepwater Horizon oil spill in 2010. This was a terrible tragedy in the Gulf of Mexico. Some of y'all may not even remember that, but yeah, a terrible ecological disaster in the Gulf of Mexico. And you're going to learn about the importance of scientific examination. So the company, BP, was in charge of, at least at first, looking at how to fix this problem, how to stop this oil spill, because it was just gushing out oil into the Gulf of Mexico day after day after day. And so they had their scientists working on this. They were trying to determine how big of a problem it was and how they were going to solve this. The problem was, of course, they're going to have some bias because they work for the company BP. BP doesn't want this to be in the news anymore. BP wants this to be taken care of as quickly as possible. And they just want to hush it up, really, right? Because they're a company. They're trying to make a profit. And it's not making a profit if everybody's not buying your product because you're causing such ecological damage. So scientists had to step in. Government officials had to step in. Scientists had to step in. And they determined that there was way more oil coming out of that leak, that particular oil well, than the BP scientists were saying. And they also realized that the strategies that BP was using was not going to stop the flow of this oil. And so they came up with some different strategies, and those actually worked. So take a look at that, because that's also going to show you the importance of using science in the correct way with no bias. This week, you're going to revise your rough draft. So you put together a lot of work in week 4. You are also going to add a section on developing a hypothesis. So what the heck is a hypothesis? It is a question that you're going to answer through experimentation, right? Now, of course, you're not going to carry out experiments on your topic. But anyway, you're going to figure out how your question could be answered. So the thing is that you've already developed a question. So what's the difference between your question and your hypothesis? So your question is an overarching type of question. Some of you have said, can ocean acidification be reversed, right? Or maybe you chose electric vehicles and you said, can electric vehicles actually change climate change and not reverse it, but stop it from continuing forward? Okay, those are big overarching kinds of questions. You can't just develop experiments to test whether ocean acidification can be reversed, right? Your hypothesis has to be shrunken down to the point where you can actually conduct experiments on it, okay? So you have to be much more specific with a hypothesis. You might want to say, I don't know, I'm thinking off the top of my head, how much carbon dioxide is released from an electric vehicle through the whole production process? That might be something that you want to check. And maybe you want to compare that carbon dioxide production to the production and running of a gasoline-powered vehicle. So you could test that, right? For ocean acidification and the reversal of it, you could take salt water, you could set it at different pH levels, and you could test different ways to reverse the lowering of the pH. You could put different gases over the top of it. You could, let's see, I don't know what you could do. You could put different chemicals in the water. There's all kinds of things that you could do. So you see how your hypothesis has to be more specific, because you have to be able to conduct experiments in order to answer your hypothesis, whereas your question is just an overarching question that you're interested in. Make sure you use your rubric to guide your work. And of course the guidelines. The guidelines and the rubric go hand in hand. So use those. Make sure you go back and fix your rough draft from week 4. I will be out of town for a few days, so it may take me a few days to get those graded. But I'll get them back to you as quickly as I possibly can so that you can make revisions. The revisions usually aren't too drastic, so just be aware of that, unless you really didn't follow the guidelines. And then we've got other problems. Okay? And your tip of the week is to use your feedback from me to improve your work. I mean, that's why I'm making feedback. That's why you're making rough drafts, and in week 6, that will be your final draft that you're turning in for your project, and then you're going to make a presentation out of it. So that's going to be important coming up. So this week is very important so that you get it right, get everything right, and you add that new section of the hypothesis. And then how are you going to answer that particular question, that problem? How are you going to go about testing for that? Okay, so use your feedback from me to improve your work. With that being said, let me know if you need anything, m.sigmon@snhu.edu. I will be in touch with you as quickly as I can through email, even though I will be out of town for some of the week. But I'll be checking my email. So I hope you have a wonderful week this week.